Guys, welcome back to our mobility work here, and Sean has agreed to flex on camera today, and he's been dealing with an issue I think a lot of people have been dealing with. And what he talked to me about today, guys, if you think about a lot of our program, right, we've been doing a lot of this motion where we're kind of curling down here, creating a lot of flexion in the grip. We're also in the rack position a lot with a barbell, which tends to wind up kind of the tissues above the elbow here in the front part of the arm. And then additionally, with all the pushing and pulling we're doing, we're getting a lot of shortening in the lats and the triceps. And so what we want to do is we want to attack this because he's experienced what's known as maybe tennis elbow or just some tightness in this elbow joint. You know I've dealt with this in the past when I used to do a lot of climbing, and these are three really nice ways that you can effectively manipulate that tissue to remove pain and get yourself back to focusing on the training. So the first thing we're going to do is, come on in here, is we're going to take two objects. So we usually just have our little fun pain ball, okay? Today we've also got the peanut, which is two pain balls taped together, which we have right up here in the front. You guys can grab one of those. Sean's gonna go ahead and put that right on the tip of his elbow. So he's looking for that kind of hot spot, okay? That hot spot is where it's gunked up. So he's gonna look for that. Other hand, he's gonna put this on top now. And this is what, again, gets wound up when we do a lot of rack position. And he's gonna just start to mash those tissues out. I would say about 2 minutes per side here. Again, slow and controlled, and anytime you find a spot that's really hot, that's where you want to spend some time really digging in, okay? So about 2 minutes per side there. Excellent. That's what we call downstream of the problem, right? So here's the problem, downstream. Let's talk now about upstream. So what we want to do is we have a barbell set up, guys, and we're going to attack, again, the triceps here. Again, a lot of pulling motion, a lot of pushing is going to have that tissue kind of shorten up. And so what Sean's going to do is we want to replicate the position we're trying to mobilize in. So what we want Sean to do is actually get into like a rack position with his palm up, okay? And he's going to start with his other hand, and he's going to kind of wiggle back and forth. That's pancaking that tissue back and forth, trying to release any sort of adhesions. And as he does that, his other hand is going to pull that barbell towards him. So you got to keep that tricep pushing down into the bar, pulling, with the other hand pulling that bar back towards you. And he's going to be able to then, again, flex his arm, which is going to expose those tissues as he's rolling them out, okay? Again, 2 to 3 minutes per tricep. And again, he's trying to hit every angle, back, forth, side to side, up and down, all right? All the way up into the armpit. Finally then, this one you're going to need a partner for, but if you've never used it, we have these amazing Voodoo Floss bands. And so I'm going to be his partner here, and what he's going to do is he's going to come up to me, and we want to now wrap that entire area. And we're going to start away from the heart. So I'm going to start below the elbow. And actually, what I'm going to have you do, Sean, is just come right here, plant your hand up, just like that, okay? Come on in, Taylor. So what we want to do, guys, is he's going to just create this stable arm position for me. I'm going to start below, and I'm going to give him about 7 out of 10 in terms of band tensioning here, okay? His goal is to keep that arm straight and locked out. I'm going to kind of do a little bit of an overlap here. I'm just going to work my way up above that elbow, okay? Once we get it up there, I'm actually more like a 6 out of 10 for you right now. Once we get it up there, okay, we're at an 8, Sean says. And what's important is we don't make a pain face, okay, so he's going to keep it cool. And now once that joint is encapsulated in that, he's going to go find himself an elevated position, and he's going to go through the motion that's causing the issue, which is going to be a push. So just do a regular push-up off the box, Sean. You can turn your hand around. Turn your hand around now. And what we're looking for, come on around again, Taylor, is with this band pulling all the muscles in tight. Go ahead and do a few push-ups for me. I would say get about 10 to 15 reps in here. As he works through, this band is now forcing those tissues to relinquish some of that adhesion, that scarring. He's going to get good blood into the area, and this is kind of like the end-all be-all. The other ones are going to help a lot, but this one's going to help the most, okay? It's going to effectively take all that scar tissue and just get it out of there and let new blood come to the area, which will help heal it, okay? And then the final test, once we take this off, okay, the nice thing about mobility, guys, is you can use your movements as a cue for did it help or did it not. So he had pain before, okay? Now he's going to go through another motion. Just rack that barbell, Sean, and see if you still have any of that same pain. Any pain still? Feels the same, better, or worse? Feels better, okay? So there you have it. So we're going to go through the other arm now, but you guys can use this to help yourselves remove pain in the elbow joint. If you've dealt with tennis elbow, comment up if it helped. And remember, test it first, do the work, and then retest. See you later. Boom!